Hello and welcome to Health Talk. I'm your host, Angela Baracco-Eddy. With me tonight is Dr. Rick Newman. He is a board-certified gastroenterologist with the Baptist Division of Gastroenterology Associates, and you can find him at the Endoscopy Center on Davis Highway, as well as the various offices that the Baptist Hospital has in the area. They've got him at Pace, they've got him on 9 Mile Road, all over the place, Gulf Breeze Hospital. So you can find them all over. We hope to see you at one of their locations very soon. This episode tonight is live, so the numbers will be on the screen throughout the program. If you have a question or a comment on our topic this evening, we would love for you to give us a call. The numbers again will be on the screen, 432-7768, or if you're outside of the Pensacola area, the toll-free number is 1-800-950-2522. We would love to get your question or comment on the air on tonight's topic, which is nutrition, weight loss options, weighing your options. So we'll be talking about that in quite a bit of detail. Again, Dr. Rick Newman is the guest this evening. He will be talking specifically about weight loss, and we'll be talking about a lot of different things relating to that, but I always like to start off with the basics. So, Dr. Newman, of course, hello. It's good to see you again.
Yes, too. Thanks for having me.
Thank you for being here. I like to get started with just the basics. What is gastroenterology first? And let's talk about that.
It's the study of medicine related to the gastrointestinal tract, which actually starts at your mouth and ends at the other end. And it also involves the pancreas and the liver, which a lot of people don't realize that. So we take care of patients who have problems with the esophagus, the stomach, the small intestine, the colon, the liver, and the pancreas.
So it's kind of a lot of things all encompassed there in that kind of broad specialty, the gastroenterology. Tonight we're going to focus specifically on obesity and then weight loss, nutrition, some of the options that you may have if you are obese. Let's kind of talk for a minute about what is obesity? What is the definition? A lot of people hear about it. It's big in the news. It's certainly a big topic these days. But let's talk about the basic definition of obesity.
Sure. So obesity has a very strict definition, but what is interesting is that it's defined differently in different countries. So the average weight in America being as high as it is, we define obesity as a heavier weight than they do, for example, in Sweden. But in this country, obesity is defined as what we call a BMI of over 30. And it's a calculation that I don't want to get into the details of the calculation, but you can look online, anybody can look online, and there's actually little apps where you can plug in your height and your weight, and it's based upon height and weight. Because as you can imagine, a person who's 6'4" and weighs 220 pounds may not be obese at all, whereas somebody who's 5'2" and weighs 220 pounds most likely has obesity and has a high BMI. So a normal BMI is considered 25 or less, and anything above 30 is considered obesity, and in between the two is called overweight. And then there are categories above 30 where there's terminology. This is obesity, severe obesity, morbid obesity, that sort of thing. But it's based upon a combination of your height and your weight.
And again, it's something that's relatively easy that you can look up. If you go to a BMI calculator, you can Google that, you can look for it on your phone or whatever, as an app, like you said. Enter your height, enter your weight, and it will tell you what your number is. And again, for obesity, it's 30 or over.
Correct.
What are some of the different factors that lead to obesity? Obviously, eating too many calories. That's what a lot of people talk about.
Yeah, it is. You know, it's a complicated topic, and it's interesting because in its simplest form, we all burn calories every day, and in the process of doing that, we generate heat. And when we take care of patients that are in a coma, for example, we have to feed them. Even though they're not moving at all, they're not exercising at all, obviously, just the act of staying alive, the heart beating, the lungs moving, the kidneys working, requires a certain amount of calories every day. And to put things in perspective, we have a new program in the office for weight management and obesity, and it involves getting on a part of the program involves getting on a scale that actually sends an electric current through your body and measures what your basal metabolic rate is. And I just got on the scale myself on Monday just to see.
Sure.
And for me, and I'm 5'8" and I weigh 176 pounds, but my basal metabolic rate was calculated to be slightly over 1,600 calories. So if I was in a coma, you'd have to give me 1,600 calories to keep me at my current weight right now. Now, obviously, the act of walking around and doing things adds to that, and you burn calories. But it's in its simplest form. If you're taking more calories in than you're burning every day, your body will store those calories, and it's very efficient at doing that. You know, we're sort of designed. If you go back 10,000 years, we didn't have a Burger King and McDonald's and Golden Corral on every corner.
Right.
So food was scarce, and our bodies are designed to, number one, digest everything very well and absorb everything very well and store everything very well. And so all it takes, about 96% of what we put in our mouths actually is brought into our body. There's a little bit of waste that goes out the other end, but it's a very, very small amount. So in its simplest form, obesity, sorry for the long answer,
no, that's perfect.
is taking in more calories than your body burns in a 24-hour period. It's like a bank account. And if at the end of the day you deposited 10 cents but you only wrote 9-cent checks, your bank account went up by 1 penny. And over time, people's BMI will slowly creep up if you're in a positive balance. So in its simplest form, that's what causes obesity, but it's much more complicated than that.
Right. Does your basal metabolic rate, is that what you called it, does that change as you age?
Absolutely. It changes, excuse me, during pregnancy. It changes with your level of activity. So if you take a person that exercises, let's say I got into a heavy exercise program and then went in and got on that same scale the next day, not immediately after exercising, just after exercising, your metabolic rate actually increases because of your exercising. As we age, our metabolic rate actually goes down and our caloric requirements. So again, I keep on thinking of a patient that's in the hospital, that's in a bed that's not moving. We have a formula that we use to calculate what that person needs, and age is part of the formula.
Wow.
Fever is part of the formula, so illness is part of the formula, so there's a whole bunch of things. But I'll tell you, the thing that makes the biggest difference with all of these variables in terms of whether you come out ahead or negative at the end of the day is what you put in your mouth. You know, we've all gotten on an elliptical trainer or on a treadmill and you sweat like crazy for 20 minutes and it says, congratulations, you just burned 90 calories.
Yes.
And you go, that's 3 bites of a cheesecake.
Exactly.
So eating is, again, we're very good at putting calories in and sucking them up. It's much harder to burn them off. And that's why exercise is important, but without some dietary changes or something that affects the calories that are getting in, it's very, very hard to get on the other side of that equation and watch your BMI begin to decrease.
Does it matter what kind of food you're taking in, or does it just matter the base calories that you're consuming?
Both are true.
Okay.
The bottom line is it's the base calories.
Okay.
But for example, fats are about 9 calories per gram. Carbohydrates are about 3.5 calories per gram. So there are some foods that are denser than other foods. And then you get into a lot more complicated metabolism, you know, in different forms of diet. But the bottom line is it's absolute calories.
Calories.
It's absolute calories.
Okay. We've had a call come in, so I want to make sure that we get to the caller. Hello, and thank you for calling. Do you have a question or a comment for Dr. Newman?
Yes, thanks for taking my call. My question is really more about my waist size. I've gained a lot of inches in probably the last 6 or 7 years, and someone was saying that it can be a real problem if you start putting on a lot of inches in your waist area. And I don't know if the doctor has anything that he can say about maybe some of the medical problems that can occur from really heavy, fat building up in the waist area. And I'll hang up and listen, but someone once told me that it can lead to some forms of cancer. So I'll listen and see what Doc has to say, okay?
Great. Thank you so much for your call.
It's a really good question.
Thank you.
You know, where people put their fat is different, and it's determined genetically, and in large part it's determined by your sex. So men tend to put their weight in the middle of their body, and women tend to put their weight around their hips and legs. And when you look at the size of your belt and the size of your pants, some of that stored fat is between the muscle of your abdomen and your skin. So in other words, if we gave you an injection into the fat, some of those inches that you have are fat that's right below your skin. But guess what? There's also fat inside your abdomen called visceral fat that surrounds all of the organs. If you ever have the opportunity or look on YouTube, now you can see everything on YouTube nowadays, watch an open operation on YouTube. And in a person that's obese, when the person's abdomen is opened up, there is a whole bunch of fat in there. And like you were alluding to, there have been really good studies looking at, especially in men, a high association with heart disease and visceral fat and waist circumference. And so it tends to be a really bad sign with respect to disease. And obesity is absolutely linked with a lot of cancers. It's not the only cause of cancer, but there's an association between being overweight and cancer. So the weight that you have in the middle of your belly is in part determined genetically. Your dad may have looked the same as you look, and also you're a man. And yes, it is affected. It's also the place that you'll tend to lose weight. You know, I was telling you about the device that we have at the office. I was a little bit skeptical when I got on this device. It's brand new in our office. Because one of the things that it does is it calculates your total body fat. And for example, the percentage of your weight that's fat, mine was 19%. And it also tells you how much is in your arms and how much is in your legs and how much is in your stomach. And I'm thinking, wait a second, how does it really do that? It sounds a little hocus pocus. But when I looked at the report, I had hardly any fat in my legs, and I can tell you it's a good thing that this camera is from here up, because I have chicken legs. You cannot pinch any fat in my legs. I have skinny legs, and so it actually it's accurate. And the problem is again, it's worrisome to me, because this is where men tend to carry their fat, and it is associated with heart disease and vascular disease and diabetes and fatty liver, and what we call the metabolic syndrome, which is diabetes, high blood pressure, high cholesterol. So it's important. It's definitely important.
So we've talked about how the calories are really the thing that causes obesity, probably most primarily. But there are some other causes too. What are some other causes of obesity?
Well, you know, I guess I can answer your question in a couple of different ways. It becomes important. Can I rephrase your question for a second?
Absolutely.
You know, the bottom line question is, what can we do to lose weight?
Right.
Right? And now there are some really rare genetic diseases that cause obesity, but they're really rare. There are also some hormonal things like hypothyroidism, having an underactive thyroid. Very easy to diagnose, very easy to treat. So those things make up a sliver of the causes of people being obese. And when I said that it's more complicated than just a simple formula, it's complicated because you would think all you need to do is eat less. The problem is we're not very good at getting people to eat less. That's the complicated part of obesity, is trying to fix the problem, is treating the disease. That's really where the challenge comes in and where it becomes complicated. And it doesn't seem that all causes of obesity in all individuals are caused by the same underlying problem. Some people are addicted to food. That's their vice. Other people, they're not so much addicted to food, they're just really eating incorrectly, and they may be uneducated and they don't know what they're eating. I've actually had patients tell me they made a big change in their lives. They stopped drinking Coca-Cola. And I said, boy, that's great, because I'll tell you, if you can cut out Coca-Cola and potato chips, especially in children, there have been some studies showing that 25% of the caloric intake of kids in this country is from soda.
25%?
Of the caloric intake. Kids are getting 25% of their calories from soft drinks. Okay?
Wow.
But I've had patients tell me, I made a big change, I stopped drinking Coca-Cola, and I say, that's great, what did you replace it with? And they say, Sprite.
Which is the same calories.
Absolutely. And
same
people
sugar, same calories.
Just, people don't know. So it's complicated when you look at how do you fix the problem? How do you get people to lose weight? And one of the problems is food tastes very good. And it's part of our culture, we enjoy it, and it's so readily available, and it's gotten to be very, very inexpensive. The cost of calories in this country has become so inexpensive. That's not much, in most countries, people that do not have means or are poor are skinny. In this country, people that don't have means and don't have a lot of money tend to be obese.
Because you can get a lot of calories for very cheap. On that note, we're going to take our very first break. If you have a question or a comment, give us a call. We'll be right back with more Health Talk.
Our weight, it's with us every day. It's not that we don't try to say goodbye to our excess weight. We do. We exercise, we eat healthier, we try to stay active. But for many of us, it's simply not enough. Well, there's finally a solution. Introducing Orbera, a non-surgical procedure to achieve meaningful long-term weight loss. Orbera is a new non-surgical weight loss procedure that can help you gain the edge and lose the weight. People lost more than 3 times the weight with Orbera than diet and exercise alone. Orbera gives you that edge you need to lose the weight and power a more confident, healthier lifestyle. Orbera is not for those who are pregnant or breastfeeding, have autoimmune or organ disease. Heartburn, stomach discomfort, abdominal pain, and bowel obstruction are rare. Other adverse events include nausea and vomiting. Find out more and see if Orbera is right for you.
Has anyone ever said, you're the picture of health? You look healthy, you feel fine, but that may not be the full picture. Colorectal cancer is the second leading cancer killer of men and women over 50. It doesn't always cause symptoms, but it can be prevented. Screening can find precancerous polyps, so they can be removed before they turn into cancer. Get screened. Make sure you are the picture of health.
Hello and welcome back to Health Talk. I'm your host, Angela Eddy, and with me tonight is Dr. Rick Newman. He is a board-certified gastroenterologist with the Baptist Division of Gastroenterology Associates, and you can find him at the Baptist locations that are around the area at Gulf Breeze Hospital, the one on East Street. I'm sure they're all over the place here. There's
North Davis Highway,
Pace,
Gulf Breeze, Foley.
Lots of locations where you can see these guys. So if you would like to set up an appointment or if you have anything like that, check out the Endoscopy Center. Their website, it'll be on, it's on the screen right now, www.endo-world.com. That has all of the different locations and contact information, or you can call the Endoscopy Center and they will absolutely take care of you there as well. Tonight's topic is nutrition and your weight loss options, weighing your options and obesity. We've been talking about that, about obesity, kind of getting into for the first segment of the program. We are live tonight, so if you have a question or a comment and you'd like to get your question on the air, give us a call. The numbers will be on the screen throughout the program, 432-7768, or if you're outside of the Pensacola area, the toll-free number is 1-800-950-2522. And again, tonight's topic is obesity and nutrition, weight loss, weighing your options. We have had a call come in as soon as we got back from the break, so I want to make sure we get to the phone and get the question answered, and then we're going to get into some more detail as we continue with our program. Hello, and thank you for calling. Do you have a question or a comment for Dr. Newman?
Yes, I do, doctors. Thanks for having me. I have a question about metformin. A few years ago, I was diagnosed with type 2 diabetes, and when I was on the metformin, I noticed that I was able to lose weight a lot easier than prior to taking metformin, and it's really helped me out a lot. But I'm also wondering if people that don't have type 2 diabetes can use metformin possibly as a weight loss supplement.
Great question.
Yeah, it's a good question. You know, as you can imagine, any medicine that could possibly help with obesity has been studied. And like most medicines, in order for something to get approved by the FDA and then subsequently to be accepted by the medical community as being useful, it has to go through very, very stringent studies, placebo-controlled, double-blinded studies. And the problem is that if you take something like metformin and you study it, and it has been studied, there are people that will lose weight on metformin. There are people that will lose weight with just about any diabetic medication if you can get their diabetes under control, although there are some diabetic medicines that one of their side effects is weight gain, so it's a little bit complicated. But within these studies, there are small numbers of people, and the same is true with metformin, that it actually can be fairly effective. The problem is, in order for that medicine to get approved by the FDA and have what we call an indication to be used for obesity, there has to be a statistically significant difference between that drug and placebo in the population being studied. So you have to see that benefit in a large number of people within the clinical trial. So one of the medicines that has been approved for weight reduction in this country is called Saxenda, which is actually a diabetic medication. It's given subcutaneously. It's an injection, and it's given in a slightly higher dose just for obesity. It's a higher dose than what is used in diabetes. So there are some medicines that we see that are used for different conditions. There's another medicine, for example, called Contrave, and Contrave is a combination of two medicines. One is called Wellbutrin, which helps people stop smoking. It's also used as an antidepressant, and they combine it in a single pill with a medicine called naltrexone, which actually blocks opiates. So there's another example of a medicine that's been approved by the FDA to use for one problem, and it becomes studied, and when you combine it with other medicines, it actually is effective in weight reduction. But the number of medicines that have been approved to be used specifically for obesity, there's about 6 of them on the market, and we use all of them. They're all options for us in our clinical practice and part of the weight management program that we have. One that probably most people that are watching this have heard of is phentermine. You know, used to be combined with a different medicine. It was called fen-phen. And one of the phens caused heart problems, so now we just use one of the phens called phentermine. But there are medications, and for some people, they're the answer, and in other people, they're part of the answer. You know, almost all folks that need to lose weight, it's going to be a combination of things. It's going to be a combination of diet, exercise, lifestyle modification, medicines. We use medications quite often. And then, of course, there are operations, there's surgery, there are some endoscopic procedures that we do. So there's a whole gamut of options out there. And again, the idea is to try to nail down what an individual person needs, because one solution is not going to work for everybody.
Thank you for your call. We appreciate it. Looks like he's gone. So thank you so much. We appreciate you giving us a call. If you have a question or a comment on obesity or on weight loss options, give us a call. We'd love to get you on the air. So before the last break, we were talking about some of the other contributing factors to obesity, and we were kind of talking about how calories are cheap. I mean, you can get a lot of stuff on a dollar menu somewhere that are not necessarily the best and healthiest things for you, but they're chock full of calories.
Absolutely.
So that is something that's sort of a cultural problem.
It is, and it's also a taste problem. You know, when I went to medical school back in the 80s, we were taught that human taste was fairly simple. We could taste salt, we could taste bitter, and we could taste sweet. And now we know that our tongue is much, much more complicated than that. And fats taste very good to us. And like I was mentioning before, fats tend to be the highest caloric food that you can eat. And they taste very good to us. And if you think about it, that makes sense, because again, if you go back thousands of years, we did not have food all over the place. And so it was important for us to recognize that something was calorically rich because food was not abundant. So one of the problems is that, as I was saying before also, is that food tastes good. And the problem is that the foods that tend to taste good to us tend to not be very good for us, which is kind of interesting.
Which is a shame.
It is a shame, and it's very hard to change. I like to say that the causes of obesity are caloric, cultural, and capitalism. And caloric we've talked a little bit about, and that is foods tasting too good, foods being too available to us, people not knowing what is good to eat and what is not good to eat,
and portion size.
Or knowing it but not being able to control it, is a huge problem. There's a cultural thing as well. When we live in an environment where a large portion of the population are obese, it becomes normal. It becomes normal. And there are definite cultural differences when you look at the average weight of a Japanese person and you look at the average weight of an American. Americans are the largest humans on Earth right now. And it's estimated now that about a third of American adults actually fall within a BMI category of being obese, not just overweight, but actually being obese. And it's become somewhat culturally acceptable to us. Studies have been done looking at two parents that are obese having children and having the children become obese at a very, very young age. And most of that seems that you would think, okay, this could either be genetic or it may be environmental, meaning diet. And it's probably a little bit of both, but eating habits probably contributes the most. So culturally, there's an important aspect to things. It's interesting, if you go back to the 1500s and 1600s, being overweight was actually a sign of wealth. Because if you work in the fields or you're a laborer and you're burning 3,500 calories a day working, you're not obese. But if you have somebody doing all the work for you, you tend to be overweight. And if you ever go into a museum of art, you'll notice that a lot of the people in the paintings tend to be overweight, and those were people that had their portraits taken, and it was fashionable to be overweight. Now it's kind of become the opposite in this country, where slim is promoted on television as being good looking, but yet being overweight is acceptable if you live in a community and an environment where a lot of people are overweight. And I say capitalism in part because foods are subsidized by our government. We're a rich country and we're victims of our own success. A lot of the things that we eat are subsidized through the government, and because of competition, it's very inexpensive to go to Burger King, and it's very, when you have Burger King on one corner and McDonald's on the other, they compete with each other, right? That's part of capitalism. It drives the cost down, and it's very inexpensive to go in and buy 2,500 calories in one meal.
Absolutely. Very easy. And it's less expensive in a lot of cases to buy 2,500 calories in one meal at one of the restaurants like that, one of the fast food places, than it is to buy 2,500 calories or even a healthy dinner of 1,200 calories, 800 calories at a grocery store.
No, absolutely. And one of the other problems that we have is that foods that are easy to get a hold of and get into you quickly tend to not be very good for you. And so we're all busy. Again, it gets into the capitalism thing. I work, my wife works, we're very, very busy. You're raising children. You don't have a lot of time to come home and cook a full meal with fresh vegetables and from scratch. It's so much easier to take something out of the freezer and pop it into the microwave or stop by Taco Bell on the way home. So again, we're in part, it's a cultural thing and a capitalistic thing for us. There's also problems in this country. Everybody's heard of this, where there are fresh food deserts in this country, where people cannot. It's very hard for them to go buy fresh food and healthy food. They can go down to the 7-Eleven and they can get honey buns and they can get potato chips and they can get hot dogs, but it's very hard for them to go to a grocery store where there's fresh produce and healthy food. So there's a distribution problem in our country. So there, and this again gets to the idea of is obesity simple? Yes, it is, but is it also complex? And the answer is yes, it is. You know, we're fortunate that we live in a community where most people have access to health care, and most people, if they have the desire, can seek out some help. And I would, as an advocate for health, I would highly recommend that if people are struggling with this and they realize that they're struggling with this, that there are places where they can get help. And you know, we have that availability in our practice, and there are other facilities that do as well.
Absolutely. It's definitely something to keep in mind, and as he said, it's important that you find out what your BMI is, find out where you fall on that scale, and if you are outside of that range, you do something about it. When we come back, we're going to take a quick break, but when we come back, we're going to talk about some of the reasons why obesity is bad, and we'll do that when we come back with more Health Talk.
It's impossible to replace anybody that you loved. She was my great role model, my Grandma Keaton. It was pretty much of a shock for us when she got colon cancer. None of us were prepared for that. Here's the deal, and this is the bottom line here. Colorectal cancer is the second leading cancer killer of men and women over the age of 50. And you know what? This is one that you can prevent. Just get screened, okay? I know how precious life is right now. We can all do this. You can do it, I can do it. I can do it, you can do it, okay? How's that for a deal?
Our weight, it's with us every day. It's not that we don't try to say goodbye to our excess weight. We do. We exercise, we eat healthier, we try to stay active. But for many of us, it's simply not enough. Well, there's finally a solution. Introducing Orbera, a non-surgical procedure to achieve meaningful long-term weight loss. Orbera is a new non-surgical weight loss procedure that can help you gain the edge and lose the weight. People lost more than 3 times the weight with Orbera than diet and exercise alone. Orbera gives you that edge you need to lose the weight and power a more confident, healthier lifestyle. Orbera is not for those who are pregnant or breastfeeding, have autoimmune or organ disease. Heartburn, stomach discomfort, abdominal pain, and bowel obstruction are rare. Other adverse events include nausea and vomiting. Find out more and see if Orbera is right for you.
Hello and welcome back to Health Talk. I'm your host, Angela Eddy. With me tonight is Dr. Rick Newman. He is a board-certified gastroenterologist with the Baptist Division of Gastroenterology Associates. And tonight we are talking about obesity, nutrition, weighing your options for weight loss. We've had some great calls that have come in. We are live this evening, so if you have a call, if you have a question or a comment, we would love to get you on the air with Dr. Newman. The numbers will be on the screen throughout the program, 432-7768, or if you're outside the Pensacola area, the toll-free number is 1-800-950-2522. Again, we'll be taking your calls on the air, but we've had a few calls, or a few callers that haven't wanted to be on the air, but that have had some interesting questions, and I want to get to a couple of those questions before we take our next break. So if you do have a call, please do so, but if you have a question but you don't want to be on the air, they'll take your question and get that to us as well. Dr. Newman, one of the calls that came in talked about sugar specifically, and they said sugar is just in everything. If you go on a very strict diet to just cut out sugar in the things that you know that you can cut out sugar, will you see rapid weight loss?
You know, it's first of all, let me just say, you have to be careful, and I would recommend a couple of things. First of all, if somebody is going to make a dietary change, there are sort of 2 ways of looking at that. One of them is that you're going to make a change for a short period of time to try to get weight off, understanding that you're not going to be able to maintain that dietary change. Okay, and we know that, and we talked about this earlier, as your weight goes up, it becomes harder to exercise, your metabolism slows down, a whole bunch of complicated changes occur in the metabolism that really put you behind the 8 ball. And people will tell us, and they are correct, I have tried to lose weight and I can't lose weight. And so sometimes it's important to try to get some weight off very rapidly to get somebody back to a point that they have a fighting chance. Okay? And so you can look at one type of diet, whatever that diet is, as part of that type of a plan. But probably as important, if not more important, is any dietary change that you make, are you going to maintain that? Because if you can't maintain that, then you're just going to put the weight back on again for the most part. That's the problem with fad diets. Is that you may lose 20 or 30 pounds, but if you end up doing exactly what you were doing before you went on that diet and you don't make any lifestyle changes, for the most part, the weight comes back up again. And so, to answer your question, you can read about, for example, the Atkins diet or the South Beach diet or the modified Atkins diet. And those are diets that are low in carbs and low in sugars. And you have to be a little bit careful because it tends to, when you cut back on carbs, then relatively speaking, the fats and the proteins go up. And you have to be a little bit careful, especially with the fat, if you have high cholesterol, high triglycerides, or susceptibility to coronary artery disease or vascular disease. So, I'm not saying that everybody needs to see a physician to go on a diet. I'm just saying you gotta be a little bit careful and take those sorts of things into consideration. I hope that answers your question.
Yes, and thank you. We appreciate you calling in and asking that question. Before the break, again, we were talking about why is obesity bad? What are some of the problems that it can, and I know, we've kind of talked about it a little bit, but let's dive into that just a little bit deeper and talk about some of the reasons why it's bad.
Yeah, no, it's a good question. I like to think of that answer as having two parts. The first is quality of life and the second is quantity of life. As physicians, there are two things in very broad terms that we do. One of the things that we do is we try to make people live longer. Okay, and we call that longevity or quantity of life. But the other thing that we do is we try to make people's lives better. And sometimes those two interact with each other and are directly related to each other, and sometimes they are not. For example, somebody with terminal cancer, we're not really looking at longevity anymore. We're not looking at quantity of life. What we're looking at is quality of life. And for some people, if you have a BMI that's 32, if you statistically, or actually let me say this, there have been some studies looking at people that are actually overweight, they're not quite obese, and looking at their risk of complications following heart surgery, and they actually do better. So you have to be a little bit careful in the lower ranges of obesity when you talk about longevity. But I can tell you that with a BMI over 35, statistically it takes 10 years off of your life. Okay?
Wow.
So the average American man now, their life expectancy is close to the mid-70s, and in women it's in the low 80s, and you can knock 10 years off of that. By having a BMI that falls into the obese range. But I think personally, what is more important than that is what happens to your quality of life. The quality of life is dramatically affected by being overweight. And when you're young and your muscles are strong and your kidneys are healthy and your heart is healthy and your lungs are healthy if you never smoked, it doesn't affect you that much. It becomes an appearance thing, maybe important with respect to dating and things like that. When you start getting into your 40s and 50s, it begins to catch up with you. And it starts dramatically affecting your quality of life. And when you get into your 50s and 60s, it affects your quality of life in a big way, because you end up spending a lot of time at the doctor's office, and you spend a lot of time having surgery for your back pain, and surgery for your bad knees, and surgery for your bad hips, and taking arthritis medicine because your feet hurt. I mean, think about it. If you're 5'7", and your ideal body weight is somewhere around 135 pounds, but in fact you weigh 200 pounds, what I'd like you to think about is taking 2 bags of flour or sand that each weigh about 30 pounds and putting them on your shoulders and walking around with those all day long. It's gonna hurt. You are not going to feel well. And when you do that for years and years and years, it begins to wear out your body. And not only your joints and your skeleton and your muscles, but it also, your heart now has to work for 1.5 persons instead of just one. So the heart muscle begins to wear out. So the quality of life is dramatically affected by being overweight. You know, how many people that weigh 250 pounds are able to go out and play ball with their grandkids? You know, or go for a bike ride. And you know, it's interesting, you go to Walmart and you see people going around in the electric car, you know, in the electric carts because they're too obese to walk around. Those are the people that ought to be walking in Walmart, not riding around in a cart. The reason that they can't is, again, it's gotten to the point that it's not just their weight, their legs hurt too much to walk. And their back hurts too much to walk. It's just not worth it anymore. And so you can imagine how that person has gotten behind the 8 ball. I mean, they can't even walk at Walmart anymore. They have to roll around in an electric cart to buy groceries. You know, so it dramatically affects your quality of life. In terms of the specific diseases that we see, I'll just say very broadly that many cancers have a much higher risk associated with a high BMI. But I don't want to go into that so much because it's almost a topic unto itself. But the diseases that we see almost ubiquitously in people that have a high BMI are high blood pressure, diabetes, fatty liver. It's associated with heartburn, or what we call GERD. And then we talked about problems with your spine and problems with the joints in your lower extremities. So diabetes, high blood pressure, high cholesterol, vascular disease, that's called the metabolic syndrome, and then problems with your skeleton and your joints. And those conditions are super common. Super common. And I'll tell you, if you walk into Baptist or Sacred Heart Hospital right now, and you walk into the intensive care unit, and you look at the people that are in the ICU, I would venture to say that over half of them, and sometimes all of them, have a super high BMI. I mean, our hospitals are full of people that are in there primarily because of obesity. It is shocking. It's an unbelievable problem. And what's so interesting is that, again, at its most basic form, it's theoretically the easiest, cheapest disease to treat. As a matter of fact, if you treat it, you save money because you're not buying as much food. That's an oversimplification. Again, high caloric foods are cheap. You know, so theoretically it would be more expensive to eat healthy. So that's true, but you understand my point. It's a self-inflicted disease that has a dramatic impact on what a person's life experience is beginning in their mid-40s and leading up until they're in their mid-60s, at which point they usually die of complications due to these diseases that have been inflicted by overeating or eating the wrong foods.
It's really amazing that it can have such a dramatic effect, that what you eat, that your nutrition, that your habits, because it really is habits. It's what you're eating habitually. It's that you're not exercising, that you're not active. It's a habit that you get into. Or if you do start exercising, then that becomes a habit. It's shocking what a difference that makes.
And a lot of this is learned. You know, the problem that we're seeing now is childhood obesity. You know, you should never see an overweight child drinking Coke or Sprite or a Slurpee. I mean, you're basically condemning that child to having serious health problems as they get older, because it's very hard to reverse that. And so now we're seeing a whole generation of people that are coming up that have been obese since childhood. And it's very difficult. It's a huge healthcare problem in this country. One of the questions you want to ask, a caller had called in a little while ago and left a question for us that's kind of complicated and hard to answer, but it sort of relates to this if you want to.
And I'm sort of going to read this because I think that we're going to have to take a quick break first. Sorry, we're going to take a quick break, but as soon as we do, we're going to come back with a question that was called in. If you have something that you'd like to ask on the air, give us a call. We'll be right back with more Health Talk.
Our weight, it's with us every day. It's not that we don't try to say goodbye to our excess weight. We do. we exercise, we eat healthier, we try to stay active. But for many of us, it's simply not enough. Well, there's finally a solution. Introducing Orbera, a non-surgical procedure to achieve meaningful long-term weight loss. Orbera is a new non-surgical weight loss procedure that can help you gain the edge and lose the weight. People lost more than 3 times the weight with Orbera than diet and exercise alone. Orbera gives you that edge you need to lose the weight and power a more confident, healthier lifestyle. Orbera is not for those who are pregnant or breastfeeding, have autoimmune or organ disease. Heartburn, stomach discomfort, abdominal pain, and bowel obstruction are rare. Other adverse events include nausea and vomiting. Find out more and see if Orbera is right for you.
Has anyone ever said, you are the picture of health? You look healthy, you feel fine, but that may not be the full picture. Colorectal cancer is the second leading cancer killer of men and women over 50. It doesn't always cause symptoms, but it can be prevented. Screening can find precancerous polyps, so they can be removed before they turn into cancer. Get screened. Make sure you are the picture of health.
Hello and welcome back to Health Talk. I'm your host, Angela Eddy. With me tonight is Dr. Rick Newman. He is a board-certified gastroenterologist with the Baptist Division of Gastroenterology Associates. Tonight's topic is obesity and nutrition, weighing your options for weight loss. We've been talking about it in quite some detail, and we have had some calls that have come in, but they didn't want to be on the air. But there's some very interesting questions, so I want to make sure that we ask those and we get those answered while we have the program going. So Dr. Newman, before the break, we were talking about one that is a little bit more complicated, but I think it's relevant, and especially to the conversation we were having just before the break. This one says, what's the cost of obesity? It's hard to tell people what you can and can't eat, but should there be potentially healthcare incentives or some sort of discounts for people who are able to achieve and maintain proper weight?
Yeah. And actually there are a lot of companies and corporations now. I was just visiting with my family up in North Carolina, up near the Research Triangle, and my brother works for an energy company up there, and they all have Fitbits, and if you have so many steps per week, they reduce his I think it's his deductible or his contribution to his health insurance by $100 every month at the end of the year. Wow. If he reaches a certain goal. Unfortunately, I saw him, he took it off and he was sitting there shaking it like this, making it look like he was walking. So you can cheat. But there are incentives. You know, the more difficult problem though is that the cost of obesity in the United States is huge. You know, most Americans in the United States die as a result of cancer, and cardiovascular disease was the #1 cause until I think it was 2015, and cancer surpassed cardiovascular disease for the first time. But obesity being so much related to directly related to both of those conditions, it costs this country a huge amount of money, and our premiums are huge and our deductibles are huge. You know, I'm not only a physician, but I'm also a patient, and I pay for my insurance. And people have talked about coming up with incentives or discounts. For example, if you buy life insurance and you're a smoker, you pay more money for your life insurance, right? Well, maybe if your BMI is 25, your health insurance premium should be less. The problem is it's very politically sensitive.
Absolutely.
You know, it's very, very politically sensitive, and it gets down to issues that are very are difficult to talk about, you know, things like self-control, and are people responsible for what they do in their lives, or are they a victim of circumstance, and that sort of thing. And so it's very hard to talk about, and it'll be interesting to see if some of those things will come about with some of the new changes in healthcare policy. But it's a really, really good question, and we think about it as physicians because people that are taking care of themselves end up paying essentially for the health care for a small number of people. 50% of the United States healthcare expenditures are spent on 5% of the population.
Wow. That's a huge number.
And we see this, again, if you go to the hospital where most of the money is being spent, because those people are very sick, a lot of things are being done, interventional procedures, surgeries, operations, things like that. They tend to be the same people that come back and forth. They go home, they get sick, they come back to the hospital. They go home, they come sick, and we spend a whole bunch of money on people during the last 5 years of their life, and sometimes a lot of money on people during the last 6 months of their life in an attempt to try to save them, when in fact, there's not a lot that we can do.
Right. Right. Very interesting. That was a great question. Thank you for calling that one in. I want to talk briefly, because we're going to run out of time if we don't kind of get to things quickly. What are some of the treatments? What are some of the things that can be done to treat obesity?
So, like I said, the cheapest, easiest is to just stop putting calories in your mouth. That's the easiest thing, but it's easier said than done. And that's the first step. We do that with everybody. That is the one thing that we do with everybody is, whether we use medication or we recommend surgery or we do an endoscopic procedure, those things are optional and we have different plans for different people. But everybody, we work on diet and exercise, because that has to be the foundation of the changes that are made. The other things are used to help people, to try to help them get to change their lifestyle and change what they eat and their exercise. And there are medications. We talked about them. We didn't talk about them in great detail because this is not a good venue to go into great detail of pharmacology of obesity medication. But there are medicines that we use. They're all prescription. There's one medicine over the counter called Alli, ALLI, that you can buy. It also comes in a prescription strength that's just a greater number of milligrams. But what it does is it blocks one of the enzymes that your pancreas produces that digests triglycerides. So what happens is you eat fat and it doesn't get digested, so it passes through you and ends up in the toilet bowl. A small fraction, but yet it is something, and you can buy that over the counter. It has some kind of nasty side effects. Specifically diarrhea, but people, that's the one thing that you can buy over the counter. And then there are endoscopic procedures that we do, and we're making pretty great advances in our ability to go through the mouth and perform procedures in the upper part of the GI tract that lead to weight loss. The surgeons are very good at it. They've been doing it for a long time. It requires a general anesthetic and a laparoscopy most of the time, where they go through your belly button with cameras and rearrange the upper GI tract that either causes a partial obstruction that forces you to eat less, or it moves food further down the GI tract so you don't have the opportunity to absorb or digest everything that you're eating, like Roux-en-Y gastric bypass. Wow. So there's surgery, there's endoscopic procedures, there's medications, but at the foundation of everything is diet and exercise. It has to be. And the people that undergo these operations that make them go from 500 pounds to 180 pounds, I can tell you, almost all of them are so happy to exercise. They haven't been able to walk around Walmart. They become extremely active. I mean, I have pictures of patients rock climbing, hanging from ropes that couldn't get out of a couch with surgery, Again, that's reserved for people with super high BMIs,
Sure.
When there's no other option. But those are the categories of treatments that we use to try to help people. And again, the treatment plan is customized based upon where you are, what type of diseases you have, what are your eating habits. We take into account all of those things.
And it's probably worth saying, what you're doing is physician supervised. It's not something that somebody is just going to say, hey, I'm going to just take all these medicines and do it on my own. Even with the one that's over the counter, it's probably a good idea to at least inform your physician and say, hey, is this something that I can do? Because it does change the way your body is working, and to make sure that you're healthy enough to start that to begin with.
And I'll tell you something else that I think is really important. I can't tell you how many patients that I will see for unrelated reasons. They turn 50, they need a colonoscopy, and they weigh 280 pounds. And I ask them, as I'm talking to them, has anybody ever mentioned anything to you about your weight and what your options are for helping you lose some of that weight? And I I can tell you most of the time they will say no. Nobody's ever really talked to me about this. Now, sometimes their spouse sitting next to them will look at them and go, now, wait a second. That happens too. You're not telling the whole truth. But what I can say, you know, as a patient, you need to bring it up. You know, if you know if you're overweight, you know, you may not know what your BMI is, but people that are overweight know that they're overweight. Talk to your doctor. You know, talk to your family doctor. You know, seek out some advice. Don't be afraid of that. I mean, there's very little downside in at least exploring what your options are. You know, because if you can't take that first step and be your own advocate, it's going to be very difficult for somebody to come grab you by the arm and grab you and pull you along the way. You know, I would encourage you to mention something to your physician. And if they're not interested in dealing with it, there are folks that are.
It's very good advice, and of course things can be done. Very quickly, I have one other question. Is there anything in family history that promotes obesity? Are there fat genes?
There are fat genes. There are actually fat rats that are studied. We have genetically modified rats that tend to be that are very, very obese. We haven't sorted all of that out. You know, if you look at the human genome, there's about 22,000 genes in the human genome. And we have just gotten to the point now where we can actually run a lab test and look at all of those genes. It's expensive, it's not automated yet, we don't know what to do with the information yet, but I think in the next 10 years we're going to really hone in on a lot of that stuff. And not only with obesity, of course, but I'll tell you the big thing is with cancer. You know, with cancer genes, you know, we're seeing an explosion in that area. So there's definitely a relationship between what your mom looks like and what you look like, and the same thing with your dad. Some of it is genetic, but some of it is that as a child you tend to eat what your parents are feeding you. Absolutely. You know, so it's not just genetic. Like a lot of conditions and a lot of diseases, it's a combination of genetics and what we call environmental factors.
Yep. And on that note, we're going to have to end it. Bottom line, there's a lot of options to help control that weight. If you need anything or if you have questions, call the Endoscopy Center. That's it for us tonight. Thank you so much for joining us, and we look forward to seeing you next month with more Health Talk.